We're a member of Central Valley Health Network, so as a federally qualified center, we find that it's really important to collaborate with other FQHCs to help our cause, to advocate for us, because we want to make sure that all Californians are represented.
Our mission is to see any patient regardless of any of their socioeconomics or their living situation. There's no reason or way for us to deny care to anybody.
If you're here, you're being seen. We accept a wide range of insurances, which isn't very common at healthcare centers. We have programs for every type of patient.
So we're really trying to improve access to all of our patients in our region and be able to provide healthcare for a lot more people.
Our newer patients, they come in feeling so thankful that someone's actually able to spend time with them and listen versus they don't feel like a number.
High quality care means the same standards that I would expect for myself and my family. So when we treat our patients, that they feel that they are an integral part of who we are and they are part of our family.
I was a patient here before I became an employee. When I came here, the providers and the front desk were all so nice. I felt like I was treated as a human being. The foundation of high quality care is caring about the patients. So we're able to give comprehensive care to patients and increasingly more as we get more services added.
Quality care means having everything under one roof, which is the patient-centered medical home model. Everybody who works here is motivated to have this cohesive medical, health, mental coverage. We work with each other, we talk to each other, we collaborate, and that's a hugely important thing.
We're really trying to embody that medical home. We're trying to bring services under our roof so that patients can come here and see their primary care, get their eyes checked and get their glasses, see the dentist. They can bring their children, right? They can come here during their pregnancy. So we're trying to do the whole patient, whole family, whole community.
We do such an array of everything. It's like a one-stop shop. And that's beneficial for our patients because, it's not often that they can even get to one appointment versus all the appointments that they can have when they show up here with us.
We get to take care of the people that really kind of need the most help, and we do a really good job of it.
One of the most important things for me is to be able to come here every day and make sure that the people that I interact with feel loved, appreciated, and respected.
I just love everything about being able to serve our community and be a part of a team that works together to make sure that our patients' both physical and mental wellness is addressed. Coming into work, that's my passion.
The diversity of our clientele is mirrored by the diversity of our employees, including the providers, reflect the patients that we serve.
Since we have a lot of assistants and providers who speak different languages, that really helps them and they feel very comfortable here. We do everything we can to cater to their needs and give them the special care they so deserve.
We try to take that opportunity to appreciate them for making that effort to come in and then meet them where they're at to say, how can we actually positively impact your life today?
What we've learned is that it should be patient-centered because that has been able to help us work as a team with the patient. Their goals and our goals are the same, which is to obtain adequate control of their chronic conditions as well as their preventive care.
We love the community and we're here. We want to help in every which way possible, whether it be from a socioeconomic component to their actual physical health, to understanding what they're dealing with, what they're battling, and then to feel confident and good about themselves. Each patient, each individual, to be able to move forward, to be able to succeed, to help their family and to help generations to come.
Transportation is a significant issue for our patients, so we actively work with our patients on making sure that they do have transportation.
We provide nutrition classes, nutrition education, and some of the services that help them not only see what the doctor wants for them to do, but also other areas that they help them improve their health.
There's many unique challenges that we face, but one of them is specialty care. And so one of our ways we've gotten around that barrier is to offer telemedicine services. And our biggest service that we use the most is telepsychiatry.
We are pushing forward to make sure that we have the openings, especially for those ones that then make an appointment and they need to be seen on the same day. And we have the open access. We have the extended hours for this patient. So, like I'm saying, no patient is left behind.
We also serve as a great community resource to the individuals that we serve, as well as non-patients. If they are in need of food, shelter, or any other community resource, we are very well connected with other organizations and agencies. Our greatest strength is partnerships with other individuals and agencies, as well as organizations throughout the communities.
Probably our challenge is that we're always seeking funding to help sustain us, and Cvhn helps us because I know they advocate for all of the federally qualified health centers, but also they provide us with letters of support, and it opens collaboration between the other health centers, which is really important because we're a lot stronger when we all collaborate together.
As a group, found that our voices were much stronger together in both advocacy for our valley, but also for our patients and our staff. So we've been involved with Cvhn since the beginning, and we see the benefit of being members of Cvhn.
Every patient that walks through that door, I want to consider my mother, father, brother or sister, so I want to make sure that they receive the same care that I would want my family members to receive.
Our patients come in, they get the treatment done, you can start seeing their self-confidence just improve, they're smiling again, and they're so grateful. So we're giving the same treatment and the same quality of care that you would get in a private practice.
The most exciting thing is seeing the low-risk moms with their families all around them in the birth center, bonding with their baby, and that's the part that I love because it feels like it's prevention. We're working at the other side with intervention and treatment, but I think by starting kids off, newborns off, in a family filled with love and joy and bonding and education and all the things that we do, we're creating a healthy community.
I am part of the community, and I once was first a patient. So as a patient, I had needs as well, and I knew what I needed. So now the fact that I'm in this position and I'm able to reach out and know those needs makes it really amazing. And my community, they appreciate it. They just love it. When we're out there, I hear them. I hear them saying, we love the services, we love the extra stuff that you guys provide. And it's a very, very conservative, small community, but they appreciate what's available for them.
It doesn't matter where you're from and how much money you make and what language you speak, you deserve, high quality, affordable health care. And that's really the crux of our mission. It's why we are and why we do what we do.
Livingston Community Health this last year saw nearly 80,000 patient visits. And so if I could influence our clinical staff, our behavioral staff, our dental staff to increase the level of care to these patients, to our patients, to the underserved, then my influence for that will really just increase dramatically.
Every day when I go out into the clinics and see our medical team working, I see it with my own eyes, I hear it with my own ears. It's not a job to them. It's definitely a passion.
I do what I do because I absolutely believe in the mission. My life has been focused around providing health care and improving the health of Californians for many years. This is a relatively new venue for me, but it's absolutely in keeping with my core values of improving the health of my community.